head-to-toe assessment today. I'm going to wash my hands. You look like you're well dressed, nicely groomed, with good hygiene, and you are don't look very stressful. So first, I'm just gonna check out your hair. So I'm gonna feel your scalp. It's normal cephalic. Hair distribution is evenly distributed, average textures, black in color, and then your scalp is pink tone, no lesions, no new line noted. Now I'm going to look at your face. You look like you have facial expression is symmetrical and contour, and at rest and with movement. Now I'm going to just touch your face. Does it feel the same on both sides? Any numbness or tingling noted? Okay, great. You have equal bilateral sensation. Now I'm just going to have you open your mouth. Okay, any pain or tenderness? Okay, no clicking noted from your TMJ. And then I'm going to have you check out your temporal masseter muscle. So push against my hand. Oh no, I'm sorry. Okay, clench your teeth and then move your cheek left to right. Okay, you have equal strength and resistance bilaterally. And then now I'm going to look at your neck, and it's symmetrical. Trachea is midlined, and now I'm going to do the sternocleidomastoid strength. So I'm going to have to push against my hand, the other one, so you have equal strength and resistance on both sides. I'm going to have you push against my hand for the shoulder shrug, and equal strength and resistance on both sides. I'm going to check out your thyroid, your isthmus overlays your second, third, and your fourth trachea ring, and thyroids. It's equal in size on both sides, no goiter, and no nodules noted. And now I'm going to check out all your lymph nodes, your preauricular, your postauricular, your occipital, your submental, your submandibular, your tonsillar, your superficial, cervical, your deep cervical, and your superior cervical, and your supra and infra clavicular. So now I'm gonna look at your eyes, and I'm gonna have you look at my eyes. I'm gonna wiggle my fingers. Tell me when you see wiggle fingers, okay? Okay, that's checking for the visual field confrontations, and now I'm gonna have check for the extraocular movement function. I'm just gonna have you follow my finger. Okay, normal movement, no nystagmus noted. And now I'm gonna look at your eyebrow. It's symmetrical and evenly distributed. And then your eyelids, it's within the width of your palpebral fissures. And then closures is without resistance. Your eyelashes are evenly distributed, growing outward. And I'm gonna push on your lid. Your puncta and your conjunctiva is pink in vascularity, no swelling, inflammation. Now I'm going to shine the light just a few feet away between your eyes. Okay, cornea is visible. And then I'm going to look in your just shine a light in both of your eyes. Okay, pupil are equally reactive to light and accommodations. It's about 3 centimeters round, symmetrical on both sides, and I can see the reflex. And then now I'm just going to use ophthalmoscope and look into your eyes. Your retinal background is yellowish orange. Your arteries are smaller and narrower, and your veins are larger and darker, so arteries lighter. And then your optic disc is 1 to 1:3 ratios, and the margins is round and well demarcated, and no papillary edema noted. So now I'm going to do your hearing. So tell me if you feel any different on the other side. No? Okay, that's the Weber. Now I'm going to do the Renee test. Tell me when you stop hearing the vibration. Okay, when you stop hearing the vibrations again. So I will check on the other side of the ear, and air should be greater than bone conduction. And now I'm just looking at the auricle. Both of your ears is symmetrical, no lesions. And now we'll look inside your ear. Canal is free of cerumen. It's pink. I see the handle of malice, and with the tip of on the tip there's the umbo, and then I can see the short process. And then I'm going to do the whisper test. So I'm going to massage your tragus. Just repeat after me. 4H7. Okay, that's normal. And then now I'm going to do the nose. I'm just looking at your nose, and it's symmetrical with your bridge, your tip, and your dorsum symmetrical. And I'm going to push in your ear. Okay, any trouble with breathing? Okay, so that's patent. And then I'm going to look inside your nose. There is no septum deviations, it's midlines, no discharge, no bleeding, and the membrane is pink. And then I'm going to do your sinuses. So tell me you feel any tenderness. Okay, great. Now I'm going to have you open your mouth and just check for transluminations on your maxillary. And then I do see some, so which is normal. And then now I'm just going to look at your mouth, and your buccal mucosa is pink, your gum is pink, your teeth is with good dentitions, with no caries. So I'm going to look at your tongue, if you can stick. Okay, can you lift it up? So your dorsum and ventrums are pink, no lesions, and the ventrums is midline and intact. I'm just going to have you move your tongue around. So full range of motion noted. Okay, I'm going to have you say ah. Looking at your soft and your hot palate, it's pink, no lesions or nodules, and your uvula is midline. And then also looking at your tonsil, it's absent and no nodules. And then also have you swallow. Looks like you don't have any trouble swallowing. And then I would normally do a gag reflex. So now I'm gonna just looking at your anterior lungs, and it's symmetrical. And then looks like you breathe very easily. Rate is about 16, no regular, and no retractions noted. And then I'm just gonna push. Any tenderness? Okay, no mass noted. And then I'm gonna have you say 99. Okay, absent tactile fremitus. And now I'm gonna listen. Okay, is breath sounds are vestibular throughout. And then I'm gonna have you kind of turn the other way. I'm gonna check out the posterior of your lungs. Any tenderness when I push? No. Okay, and no masses noted. Now, say 99. Okay, absent tactile fremitus. I'm going to have you take a deep breath. Okay, chest expansions about 2 centimeters, divergent symmetrically. I'm just going to percuss throughout, and it's resonant throughout. Now I'm going to check for diaphragmatic excursion. So I'm going to start and talk, or breathe out and hold your breath. breathe in and hold your breath. Okay, it's about 4 centimeters. And then do the CVA tenderness. How many of you feel any tenderness? There. Okay, great. Now I'm gonna listen for breath sounds. Okay, it's vestibular breath sounds throughout symmetrically. And then I'm going to have you turn this way, and I'm going to look at your jugular vein. No jugular vein distensions, and looking at the pulsations, no unusual waves. And I'm going to check for thrills. No thrills noted, and then I'm going to have you lay down. I'm going to I will look at your PMI and no visible PMI, and then I will just palpate, and the amplitude should be taping or brisk, and it should be less than 2.5 centimeters. And now I would listen to your heart. So your aortic, your pulmonic, your your tricuspid, and your mitral, and then I would also do the same with my bell. Your aortic, pulmonic, tricuspid, and mitral. And then I would listen to your apex for 1 minute, and the rhythm is about 70, regular, and S1, S2 sounds, no, and then I'm going to have you turn on the left side, and I would listen to the tricuspid and the mitral, no murmurs noted, and then I'm going to have you sit up and lean forward. I'm going to listen to the aortic and pulmonic, no murmur noted there either, and then I'm going to have you, let me check out your fingers. There's no clubbing, temperature is warm, legs are no loss of hair, evenly distributed, and then no edema, with good turgor, and cap refill is 2 to 3 seconds. Now I'm going to check all your peripheral pulses. I'm going to do the carotid, your brachial, your radial, your ulnar, your popliteal, your posterior tibial, your dorsalis pedis, and the rate is about 70. Grade 2 with regular rhythm, symmetrically. And now I'm gonna do your abdomen. Okay, just looking at your abdomen, no striations, normal vasculature, no umbilical hernia, and abdomen is flat, symmetrical movement, no nodules or bulges. And now I'm going to listen to bowel sounds. Right upper, right lower, left lower, left upper, and I hear gurgles and clicks, and there should be about 5 to 34 per minute. And now I'm just going to percuss. Generally, sorry, it's a little cold. Okay, it's tympanic throughout, and then I'm going to percuss for the liver. Okay, and it's about 8 centimeters, and now I'm going to percuss for the spleen. Okay, take a deep breath. It's tympany, which is normal. Now I'm going to percuss for the bladder. No dullness noted. And now I'm just going to do light palpations. Any tenderness? Okay, no mass noted. Now I'm going to deep palpation. Any tenderness? Okay, now I'm gonna do the liver, palpate the liver. Alright, now take a deep breath. Liver edges is soft and sharp and with smooth edges. And I'm gonna palpate the kidney, which is not palpable, and I'm gonna palpate the spleen, which is not palpable. Okay, and now we're gonna do some muscle and just gonna inspect your muscle and joints. Okay, first I'm just gonna let me know you feel any tenderness. Push in your shoulder, your arms, your hands, and then your legs, your knees, your ankle, and your feet. And then I'm gonna look at your neck and your spine. Okay, it's symmetrical throughout, no pain, no tenderness, no crepitus, and no deformities noted. And now I'm gonna just test for some range of motion. So I'm gonna have you stand up. Okay, I'm just gonna have you lift your arm, flexed, and then stand, ab, and add, and then I'm gonna have you do the elbow, and then pronate and supinate, and then I'm gonna have you do your wrist, flex and extend, left, in and out, and then I'm gonna have you do your neck, flex, extend, left and right, and same thing with your back to toe, back to left and to right, and then just kind of rotate. And then I'm gonna have you do your hips, so you can just lift, flex, extend, ab, and abduct. Okay, and then your knees, and then see if you can swing. Okay, and then do your ankle, flex, extend, in and out. Okay, everything looks like good range of motions. And then I'm going to have you grip my fingers, and then I'm going to have you try to abduct. Okay, and then I'm going to do the thumb opposition, just trying to push, and then we're going to push against me. Okay, I'm going to have you sit down. I'm going to do the same for your legs. Push against me. Okay, same with your foot. Okay, equal strength and resistance, grade 5 for muscle strength. And then now I'm going to do some coordination, or balance. So I'm going to have you stand up, close your eyes with your feet together. I would normally do for 30 to 60 seconds. Okay, I'm going to have you open and then walk across the room and back. Okay, and now I'm going to have you do the tandem, which is this heel to toe. Okay, you have normal gait, no swaying, and good balance. Now I'm going to have you do the pronator GIF. So put your hand out. I'm going to tap on your hand. Okay, and you hands went back to the original position, which is normal. And now I'm going to do the rapid movement. So I'm going to have you tap your hand. Okay, symmetrical good movement, and then same thing with your fingers, and then tap your heel. Okay, that all seems normal, and I'm going to have to do the nose to finger, so just put your nose, or your fingers, your nose, and then my finger. Okay, now close your eyes and do it. Okay, great. And then I'm going to do the light and pink touches. So have a seat. I'm going to do the upper extremity. Tell me when you feel a touch. Okay, now it's going to be sharp and dull.
Sharp. Dull. Sharp.
Okay. And then I'm going to get something to put in your hand. Tell me what it is. Okay, that's stereognosis. I'm going to write something on your palm. Tell me what that is. That's raphanthesis. Now I'm going to tell me when you feel 1 or 2 point, okay? Okay, great. That's the 2-point discrimination. And then now I'm gonna do the trunk. So tell me when you fill. Touch.
Yeah.
Okay, now it's gonna be dull and sharp.
Sharp. Dull.
Okay, and then tell me when you feel vibration.
Mm-hmm. Yep.
Okay, now I'm going to do on the lower extremities.
Sharp.
Touch.
Oh, yes.
Okay, now it's going to be sharp and dull.
Dull. Sharp. Dull.
Okay, great. And vibration.
Yeah.
Okay, I will do on the other toes too. And now I'm going to test proprioception. Tell me about moving your feet up and down. Okay, great. Now I'm going to test your reflexes. So there's your brachial, your bicep, your tricep, your brachial radialis, your patellar, your ankle, and now I'm going to check for clonus. Any pain? No. Okay. I'm going to have you lift your finger. I'm going to check for plantar response. Okay. And then I'm going to check for your abdominal response. I'm going to have you lay down. Okay. I believe that's all. I'm trying to think.